Hello and welcome to Health Matters on Channels Television. We're so glad you could join us. I am Mary Alale Yusuf. Now, of the 17.7 million cardiovascular deaths in 2015 all over the world, 7.4 million were due to coronary heart disease. Now, coronary heart disease could lead to heart attack. A heart attack happens when there is a sudden and complete blockage of an artery that supplies blood to an area of the heart, considerably reducing blood flow to the heart muscle. The World Health Organization says 80% of heart attacks and strokes are preventable. My guest on the show today is a consultant cardiologist and chief medical director at United Heart Hospital and Clinics in Lagos. He's also a fellow of the American College of Cardiology, the American College of Physicians, and the American Heart Association. That's Dr. Hygiene Nwosu. You're welcome to the show, sir.
Thank you for having me.
Now, imagine 80% of 17.7 million being averted. That would be a wonderful day. But let me start by asking you, what is this stuff that blocks the arteries, reducing the blood flow to the heart muscle?
Coronary artery disease, which leads to heart attack, is a result of plaque buildup inside the arteries that supply blood to the heart muscles. And this starts very early in life. In fact, in your early teens, the process starts and increases. By the time you're in your third decade, that means in your 30s and 40s, the blockage is significant. And if there is any rupture of this cholesterol-rich plaque that starts the process of blood clot formation, that can progress quickly and completely blocks the supply to that area. And if that continues for about 4 hours without any intervention, you're having a heart attack. But the danger actually is that at the time you have this complete blockage, you can actually have a cardiac arrest, which is sudden cardiac death.
Cardiac arrest is different from heart attack.
No, yes, heart attack is just the blockage of the blood supply to the muscle of the heart that is complete. For about 4 hours, if nothing is done, you have a permanent damage. Now, cardiac arrest can occur at the point of total blockage, where the heart will just fibrillate, and then you drop dead. So in other words, 50% of heart attack at the point it starts result in sudden cardiac death, which is cardiac arrest. So that is actually the one of the things I'm hoping we're going to cover.
Does anybody, do people get warning signals before this happens? Are there symptoms?
Okay, there are two types. One is you've never been sick, you've never complained, you never had any symptoms, and because suddenly you have cardiac arrest. But before we go into that, you have to then understand the risk factors.
Okay.
Because you don't have to have a symptoms to just drop dead.
Okay.
Now, there are some people that have what we call angina. They have blockage that has progressed and is blocking the artery about 70% or more. When they try to exert themselves, when they try to do any physical activity, they have chest pain. It could be heaviness, tightness, it could be indigestion, pressure. Those are the lucky ones. They have chest pain that is giving them warning.
So a simple chest pain is enough to be warned?
Especially if you have the risk factors. We're going to cover risk factors very quickly.
Okay. Let's cover them.
Yeah. So first of all, we have to understand what we are dealing with. Heart disease is very common in Western countries, and it's also increasing in Nigeria because our lifestyle are changing. We are moving away from the villages to these urban centers. We are not exercising as active as we used to be, and then we are adopting Western lifestyle. So we have the risk. Now, I can tell you that 80% of sudden death all over the world is from heart attack and coronary artery disease. And 50% of people having heart attack present for the first time with sudden cardiac death. So what we need to know your risk factors, because you may not have any symptoms to drop dead. or have a heart attack. So I think the first thing we need to know is know our risk factors. Number one, family history. If you are first-degree relative, that means
father,
mother, grandmother, grandfather. If it's a man and has had a heart attack by the age of 55, you have a risk factor.
So how about if he's a woman?
By age 65.
Okay.
Women have a delay, 10 years delay, just because of menopause. They are protected by estrogen. Okay. So by the time that's number one. Number two is age. If you're a man and you are about 40, 45 years old, you have one risk factor. For a woman, and you are 50 or 55, you have one risk factor. That's that. Now, age. As we get older, heart disease is very common in elderly population. 65, 75, very high. High blood pressure is an issue in Africans. We Africans, we have high blood pressure. It presents early, and it is very high. And because high blood pressure does not have any symptoms, most people don't seek care. And that's why it's called a silent killer. So if you have high blood pressure, it's not enough to take medicine. You must control that. Because if your blood pressure is 220 over 120 and you take medicine, it comes down to 160, you still have some risk.
Yes.
Okay, high blood pressure we need to address. What about diabetes? Diabetes is a heart attack equivalent. Okay, diabetes is so significant in cardiovascular disease that 71% risk of angina if you are diabetic.
That's chest pain.
Chest pain. You have 65% risk of heart failure if you are diabetic. You have 25% risk of stroke if you are diabetic. And you have 48% risk of heart attack if you are diabetic. So diabetes is very important. And since I came back to Nigeria here, I've seen in my practice, I've seen some diabetics that it's not well controlled. They don't even do A1C. You ask them what's your A1C, they don't have a clue. Okay, so diabetes is very important. The other thing is smoking. Smoking, anybody that still smokes, I'm sorry, you don't get it. Smoking is so bad that even the tobacco industry in America settled the lawsuit and paid several billions because they were hiding the fact that smoking is addictive. So one thing, my message to young female is that if you have a family history of heart disease and you are smoking, that is really dumb. Number two, if you are taking birth control pill and you are smoking, the risk is very high. And also, let's say that smoking is not just smoking. Secondhand smoking is also bad. Okay, I've been to, a restaurant in VI, and very nice restaurant, trying to get something with my wife, and the whole place is filled
with smoke.
They don't even have non-smoking section. What do? You just walk away.
You walk out of that place.
Because it's as bad as you are doing the smoking yourself. So physical activity is very key. Physical activity, regular physical activity.
So lack of physical activity is very bad. But as an individual, just a normal individual, what parameters does the person look at to determine their risk? Do you have to go to the hospital? Does your doctor inform you, or do you specifically ask for the test?
Yes. Before I answer that, let's just quickly complete that list. Cholesterol.
Okay.
Cholesterol is very important, and you should know your numbers. It's not just enough. You need to know what is the good cholesterol level, the HDL, the bad cholesterol, the triglyceride, and all those things. Those are important. And then obesity is very key. Okay, especially abdominal obesity. In Nigeria here, I'm seeing a lot of men that are 6 months pregnant. That is
because of visceral fat.
Visceral fat. That is so significant, and that's a hallmark of insulin resistance.
But can you get that down? Can you get that visceral fat down?
Absolutely.
How?
Two things is what you eat. What you eat and also exercise. We can cover that. There's also another thing in risk factor that I want to emphasize very quickly. Inflammation. Coronary artery disease is an inflammatory process. And inflammation begets inflammation. So if you have a state of chronic inflammation, the risk of disease is high. And that brings me to dental hygiene. If you don't have regular flossing and dental cleaning by a dentist or dental assistant, the risk of heart disease because it's a state of chronic inflammation.
Wait, hang on. Dental hygiene?
Absolutely.
And heart disease?
Absolutely.
What's the connection?
inflammation. If you have periodontal disease, you have bacteria, and it's an inflammatory process. And when you have an inflammatory process, it can actually trigger plaque rupture. Remember the plaque rupture.
Plaque rupture.
So, and also there are a lot of inflammatory conditions that smoking also produces inflammatory condition, and pollution.
But must plaque build up? Can't we just live a plaqueless life?
You will. Let me tell you, it's a natural process. Even
just like aging.
Remember aging. As you age, you clog up. However, you can counter those things. You can modify those risks. So, for example, the best anti-aging medication is regular exercise.
Okay.
Period. Okay. The best anti-aging. So, some of these things we are talking about, you have things. Let me just say this: diet and watching what you eat is enough to reduce that by 80%. Okay, so this is just the bedrock. So
you said exercise is the best medicine. Is it going to bring down your cholesterol? Is it going to bring down your high blood pressure? Is exercise going to, well, it will take care of visceral fat? You just said that.
Exercise can counter almost every risk factor for heart disease we talked about. And what I mean regular exercise. So, and also when
does it have to be intensive? Sorry to cut you there.
It does not have to be intensive. Moderate level of exercise can do it. And when you exercise, the metabolic benefit of exercise, where it changes your blood chemistry, occurs at heart rate of about 70 to 75% of your maximum heart rate. And that's not actually intense exercise. Even if you achieve only 60%, okay, 60% of your maximum heart rate, that will still do.
Let's just look at the screen now. There's some exercise going on there.
Okay.
Would you call this moderate level, or is this intensive?
No, this is moderate level.
This is moderate level.
This moderate
so
level.
We should do this kind of thing, like how long and how often?
You should do this about 40 to 45 minutes a day. Okay. You should do that at least 4 to 5 times a week. That will give you what to me on a regular basis.
But on being practical,
you have to be consistent.
It's not everybody that gets to go outside and do this kind of thing because of maybe job demands or family demands. So what does one do?
Actually, even taking a walk, it doesn't have to be very brisk. Even taking a walk, studies have shown that populations that do 10,000 steps a day, the incidence of heart disease is very low. In fact, there are populations that they're very active, they do 17,000 steps a day. Heart disease is almost non-existent. So what I'm trying to say is that you can have a structured physical activity, especially aerobics, 3 to 4 times a week, okay, 45 minutes each session, get the benefit. Or you can just have a smartwatch or use your cell phone to count your steps. Even if you can't get 10,000 steps a day, that is okay. Do something.